So in the past, we don't have many options. Start with surgery, try to remove as much as possible. Okay. Some chemotherapy, only few chemotherapeutic agents, all technique radiation. So that result in permanent damage of the organs, functions, cosmetically also. So they try to get everything out. Things start to evolve. They're learning more about how cancer grows, how they spread, and with the advance in the molecular techniques, molecular oncology, we know more about cancer biologies. Also the surgical equipment or more surgery expertise, so they can do better surgery, less invasive, better radiation techniques. They can deliver radiation very precisely. Also the discovery of the biological therapies or targeted therapy. So things changing very rapidly over the past 10 years. So now we can just do only limited surgeries. For example, like breast cancer, you don't have to take the whole breast out. You can just remove the lump, and you give radiation to the breast, and you give chemotherapies or added targeted therapy for some cases. So that result in much better outcome. The patient can, cure much more than before. So now we try to going into the what we call personalized medicine. So we try to deliver the treatment to the patient which is suitable for each patient, so not the same for everyone. Look at this way, because we know better about cancer biologies. We know some abnormal pathways in the signaling system from how the tumor, the cancer cell grow and divide by, trigger from some other factor from outside, or some mutation itself in the cancer cell that make the cancer cell transform from normal cell. Some mutation, so those transform to be a cancer cell. So in some cancer, so we know exactly what happened. So we can design the treatment to attack that abnormalities at the cellular level. So that's come up into the targeted treatment and what we call so far. But if you and you also have this treatment that you use also like surgery, radiation. So imagine like this, and you're going to fight the war. Cancer is the war. You use Army, Navy, Air Force, and you may have special force with maybe targeted therapies. So if you combine them in the right way, at the right times, so the patient will gain maximum benefit from the treatment and result in the more favorable outcomes. For example, for breast cancer, and some of the breast cancer we call HER2 positive, because they express the proteins HER2, HER2, that we found that would make this cancer specialized form of the cancer, different from other breast cancer. This type of cancer growing very quick. In the past, only chemotherapy alone, surgery alone, the patient survived maybe only 50% after, in 5 years. Then we give the chemotherapy, we improve the outcome, the patient survive more. And with discovery of the HER2 protein and the antibody to block the HER2s, those result in much better outcome. And even for the patient with breast cancer, HER2 positive with stage 4, means spreading already, with the combination of the chemotherapy plus the targeted therapy. So now we have not only one agent to block the HER2, we have at least 3 or 4. Okay, so those combinations result in much better outcome. Nowadays you can have 50% of the patient live beyond 5 years. Okay. So that would be like a wonderful result. We've never seen thing like this before, unprecedented outcome.